Thank you very much for inviting me for this webinar. I just want to begin by saying that it has become increasingly clear over the past 3 decades that the majority of novel and emergent zoonotic infectious diseases originate in animals and especially in wildlife. Given this background, I would like to congratulate all of you to organize this webinar and invite many of us to talk about the importance of prevention and control of priority zoonotic diseases. Historically, it is thought that 60% of currently known human infectious diseases and as much as 75% of emerging infectious diseases are of zoonotic origin or the result of a spillover event which then established itself in humans. The principal drivers of emergence of zoonotic diseases are associated with human activities, including changes in ecosystems and land use, intensification of agriculture, urbanization, and international trade and travel. While many high-income countries have successfully reduced or eradicated zoonosis, they have utilized expensive interventions. But the heaviest burden we see is now in the low and middle-income countries, who historically have the poorest healthcare infrastructure and rely heavily on livestock economically. And it is in these countries we have also seen poverty is a driver and consequences of zoonotic diseases as people heavily rely on animals for their economic livelihood and sustenance. Now, how does WHO look at the zoonotic diseases? WHO's definition is very simple. It is an infectious disease that has jumped from a non-human vertebrate animal to humans. And zoonotic pathogens may be bacterial, viral, or parasitic, or may involve unconventional agents and can spread to humans through direct contact or through food, water, or environment. They represent a major public health problem around the world due to their close relationship with animals in agriculture as companions and in natural environment. Zoonosis can also cause disruptions in the production and trade of animal products for food and other uses. Somalia continues to remain vulnerable to zoonotic disease transmission, due in part to a high reliance on animal husbandry, frequent extreme weather events, low economic development, and weak state capacity, along with geopolitical instability. But I'm happy to know that in recent time, representatives from human, animal, agriculture, and environmental health sectors conducted a One Health Zoonotic Disease Prioritization Workshop in February this year, using a multi-sectoral One Health approach. This was an attempt to develop a list of priority zoonotic diseases that are of great public health concern to Somalia. 33 zoonotic diseases were evaluated for prioritization, and 7 priority zoonotic diseases were identified for Somalia. These include Rift Valley fever, Middle East respiratory syndrome, anthrax, trypanosomiasis, brucellosis, zoonotic enteric parasites, and avian influenza viruses. This prioritization, I believe, will serve a strong foundation to strengthen One Health approach in Somalia. And I would like to reiterate that the best way to prevent and control these zoonotic diseases, including limiting its impact on countries' economy, approach. And One Health approach cuts across boundaries of animals, human, and environmental health, which is needed to understand the ecology of each emerging zoonotic disease in order to undertake a risk assessment and to develop a plans for response and control. And by definition, zoonotic diseases are infectious diseases that are naturally transmitted from vertebrate animals to humans and vice versa. And the need for a One Health approach cannot be overstated. Limiting or eliminating the transfer of pathogens between animals, the environment, and humans, therefore reducing the risk of them becoming an emerging infectious disease, is vital importance. The World Health Organization notes that the steps to achieve a One Health approach should include promoting the concept of a multi-sectoral approach, developing an integrated control package, raising the profile of neglected zoonotic diseases, collecting surveillance data to identify those at risk, and investing in the development of new tools, particularly diagnostic, to effectively control zoonosis. The term One Health was first used in 2003 or 2004 and was associated with the emergence of severe acute respiratory disease, and subsequently by the spread of highly pathogenic avian influenza H5N1. History repeats itself. The outbreak of SARS, which was the first severe and readily transmissible novel disease to emerge in the 21st century, led to the realization that a previously unknown pathogen could emerge from a wildlife source to any time and in any place, and without warning, it can threaten the health, well-being, and economics of all society. It also made us realization that there was a clear need for countries to have the capability and capacity to maintain an effective alert and response system to detect and quickly react to outbreaks of international concern. It also reminded us that responding to large multi-country outbreaks or pandemics require global cooperation and global participation using the basic principles enshrined in One Health. However, despite all the knowledge that we gain in responding to SARS outbreaks and also avian influenza H5N1 outbreak, the world did not push for One Health approach. The result was the COVID-19 pandemic, which claimed over 6 million lives so far. This is what we pay in case we do not use science, solutions that we know for the problems we face, and solidarity that we want to harness for global health. According to WHO, One Health is an approach to designing and implementing programs, policies, legislation, and research in which multiple sectors can communicate and work together to achieve better public health outcomes. One Health approach is critical to addressing health threats in animal, human, and environmental interface. Therefore, to prevent and control zoonotic diseases in Somalia and elsewhere, I call upon all to raise our voice for One Health, which is an approach to ensure the well-being of people, animals, and the environment through collaborative problem-solving approach, locally, nationally, and globally. And if we work on the One Health approach, there are 6 interconnected areas which will benefit. This is food safety, zoonotic diseases control and prevention, laboratory services, neglected tropical diseases, environmental health, and last but not the least, antimicrobial resistance. And more than just a concept, using One Health is a strategy, and we can improve surveillance and risk assessment at the animal, human, and environmental interface, especially in hotspots. We can build extensive network of multi-sectoral laboratories, animal, human, environmental health laboratories, and this will allow us to build common platforms for laboratory testing, genomic sequencing, and all relevant diagnostic and techniques. It will enhance collaboration and coordination between animal, human, and environmental health sectors, especially at the field level, which is of paramount importance. Last, it will also help us to conduct research to better understand factors that allow pathogens to cross the species barrier. In addition, it will also help us to conduct research on our ecosystem and viral molecular evolution that can trigger cross-species transmission. Health continues to be largely viewed through the restricted lens of human diseases. Environmental protection, animal health, and the sustainable health of territory that define good health area are often overlooked. As such, I would like to conclude by saying that our Director General has mentioned in recent time that health doesn't begin in hospital or health clinics. It begins outside of these perimeters. Good human health is very much dependent on animal health, our environment, our planet, and our whole ecosystem. We need to think differently, and for prevention and control of zoonotic disease, antimicrobial resistance, neglected tropical disease, and for food safety, we need a holistic vision of health and to the association between health, environmental quality, climate, food and agriculture, and biodiversity. I thank you all for giving me this opportunity. Thank you very much.